Hello to my H63D syndrome suffering friends. I wonder if your family also asks you why you seem tired all the time when you look perfectly healthy and everything seems okay. Well, to understand the H63D issues, we have that non-transferrin bound iron shards that have deposited themselves all over in our tissues and in the brain. And I wanted to, I realized I spent a little extra time with my family last night trying to play pool, and today I have severe burning pain in my shoulders and my wrists and my neck for trying to hang over a pool table. But I do try and spend time with my family as much as I can when I'm awake. But I decided that today I would like to read to you a document that I found a couple of years ago when I began to really suggest, I started to feel that H63D was really a problem that I was having, as I was being passed around from all my medical practitioners, and they could not figure out exactly why I had the symptoms that I had and why they were worsening. What I have here is a document called from Open Air. It's an H63D research guide that I give to my practitioners these days when I visit the doctor's office, so they would understand what H63D syndrome is. I'll try and put a link in this video, but here is the document. It's the Open Air document on explanations of H63D syndrome. Seems to work better if I have something to read, because I've lost a lot of cognitive ability over the years thanks to consuming too much iron and having this H63D genetic ability to overabsorb iron. So I'll read under the abstract a few notes that I made, that our ferritin levels will appear normal, or rather low, and hardly anyone will ever notice that people with the homozygous H63D mutation can develop a very serious H63D syndrome disease. The syndrome, however, is not just another type of hematomacrosis. It is a severe syndrome caused by non-transferrin bound iron, our enemy. And this can be seen if you run an iron panel, a full iron panel, that includes iron saturation and your iron binding capacity. Your saturation for us H63D sufferers will be anywhere around 50 to 100%, anything out of the normal range. And anything beyond that, when your saturation is that high, then the iron is being absorbed as the NTBI iron. Under the definition, H63D syndrome is independently a distinct entity, and the incidence of homozygous carriers of H63D mutation is about 10%, so we're so rare. It's so hard for these doctors to pinpoint that H63D is our cause of our problems. And at this time, this article was written in 2023, I believe that because our symptoms are so vast, that a lot of H63D syndrome sufferers are ignored because doctors, number one, don't believe in it, and number two, they'll end up diagnosing you with all the other secondary symptoms that are actually caused by this iron overload. And once you're diagnosed with that secondary symptom, then they're done with you. So I believe that only at this time, being that it's 2025 and it's been 2 years since this article was written, that doctors are really starting to recognize that there's a lot more of us sufferers out there. Let's see, another highlight I have on here is our saturation levels of greater than 50% automatically lead to the formation of non-transferrin bound iron, which is toxic and triggers oxidative micro-inflammatory processes. And it will deposit in parenchymal tissue, which you'll need to look that word up because it is a medical word. Parenchymal can include things, in my case, in my arteries and in my brain. This also notes that NTBI iron deposits in the substantia nigra, if I pronounce that right. That is what helps control your sympathetic and parasympathetic systems. For example, one of my earliest symptoms that didn't make sense was that I was having urinary retention problems urinating. And all of it appeared after around the age of 40. I started having these strange neurological symptoms where my head would shake uncontrollably, and I was extremely exhausted. I lost the ability to urinate without, I have to really try and force myself to urinate because it's like my bladder wouldn't empty. Also highlighted here, I have for this article, free iron of the NTBI type causes microinflammations, which essentially I just read about. The iron overload affects nerve cells in the substantia nigra, normally leading to a slow but progressive degeneration. So it starts out with these weird symptoms of arthritis, severe pain in your wrists and your ankles, and you realize that you can't go as far as you used to. You might start shaking and feeling like your muscles are extremely exhausted, and that's not the way you used to be. I mean, what happened with me is I was extremely active and very healthy, and all of a sudden I go hiking and I wasn't able to walk for almost a year. After that, I was in a wheelchair because the tissues in my ankles and in my feet they ruptured. The tissues were rupturing on a micro level, and my feet appeared to have edema, and the tissues were swelling, and my orthopedists at the time didn't know what it was. Well, additionally, I was also having neurological shaking condition where it felt like my eyes were going in and out, and I couldn't drive. I would have to stop on the side of the road in severe exhaustion, and I couldn't focus, and my head and neck would just be shaking uncontrollably. So reading further on this, the NTBI iron overload affects the nerve cells and leads to the progressive degeneration, and we have spontaneously occurring passive autoimmune reactions of variable types and severity due to these microinflammations. So that's one reason I kept ending up in the ER, because I was struggling to breathe. My heart was having problems, and I was having severe neurological symptoms where I couldn't respond, I couldn't open my eyes, I couldn't walk. I looked like I was completely poisoned. That happened a lot in 2023 when we didn't know what was going on with me, and when I was taken to the ER, the only thing that the ER could find was that I had a ridiculous response of my white blood cells, whether I had an eosinophilia was high or I had neutrophilia, they had gone high, and I've always had high monocytes. All of this is part of having this H63D syndrome. But when the doctors don't know what it is, and you're having all these neurological conditions, and all they can see is it looks to be like you're having an allergic reaction, they send you home regardless of the fact that you can't walk, you can't speak, you can't respond. Your family puts you into a wheelchair, literally straps you in, and has to take you home because at the ER they can't find anything. And this happened multiple times of my trips to the ER till I finally figured out what it is. If you haven't noticed, in my I do have some of this under control. I can't help the exhaustion, the fatigue, the joint pain, but I have been able to get over the neurological things, and I will have to share that in another video at another time, because notice these videos are really long, and I'm so sorry. I just have so much to share about this H63D syndrome because I fought for 7 hard years as my own patient advocate, because I watched my father die on his 7th year of his symptoms that mirror mine, and we never could figure it out. So I'm sorry, I have a lot to say. So highlighted also in here is there's a list of symptoms. Symptoms will show as variable motor disturbances early in your diagnosis, or early in the NTBI iron starting to really cause problems. I had Parkinson's. My father was diagnosed with Parkinson's, even though he didn't follow any of the normal Parkinson's at the time of his passing in 2004. It shows it here that you will have Parkinson's syndrome, some Parkinson's symptoms, postural instability, Postural instability, trouble standing up, trouble with your blood pressure control. That's where I've been diagnosed, POTS, postural orthostatic issues. And you have thinking disorders, often highly severe and usually primarily obsessive in nature. I don't know about the obsessive part, but I have had highly severe thinking disorders. I highlighted here that you could be wrongly misdiagnosed as having a mental illness, which my father was. They said, you seem to have dementia. And my grandmother was the same way before she killed herself at the age of 50. She also was seen as having strange mental responses. They said, you're mentally ill. But she just would not respond to people when they would come knocking on the door, and eventually she just couldn't take it anymore. On here highlighted, you have tic disorders, which are considered Tourette-like. Mine were considered like ataxia. I still do have a lot of problems shaking when I walk. I don't have a steady pattern when I walk. I walk with what my doctors called like a scissor-like ability, scissor-like symptoms. So I generally travel in a wheelchair because, first off, my feet burn and hurt if I use them too much, and at any time I could have a neurological situation where I can't walk any further. So I do tend to use a wheelchair more often than not. And hyperkinesia is listed here. I had hyperkinesia very, very, very badly. We didn't know why. I was sent to multiple neurologists, so we don't know why. And as of these days, to be tested for Parkinson's, they look for copper losses, which I didn't have. So my doctor said, you don't have Parkinson's. We're going to call it functional movement disorder because we don't know what it is. Also highlighted I have on here, dementia syndromes of various degrees with severity from mild cognitive impairment to full-blown dementia. In my case, I generally have it as brain fog. And highlighted on here, a decrease in the intelligence quotient and executive functions, which is why I mentioned in one of my other videos, I'm not employable. You don't want me trying to work on your equipment anymore. I used to be a process control engineer. I needed to make very quick decisions at times, and I worked with very complicated programming. I can't do that anymore. There's no way. But nonetheless, also highlighted on here is something that my doctors completely needed to see is by the time your neurological tics and strange rotational movements disappear, that is a sign of progressive brain damage, and that's when it's almost too late. I have found a way to slightly reverse that as I'm able to do these videos. Highlighted on here is you'll have worsening narcolepsy and a decrease in tic symptoms, which means you're on your way out the door, buddy. You're about to lose your mental capacity and your ability to eat and swallow and think. You're about to pass away. That's in my family. It seems to be around year 7. Symptoms in your other organs. Symptoms in other organs: cardiac dysfunction and arrhythmias. Oh my God! I could feel my heartbeat absolutely out of control, and then my eyes roll up, and I'm doing this, and I think I need the ER, but it turns out it's just a it's just a random micro-inflammatory autoimmune reaction. Also, other symptoms we have here are liver damage. In my mother's case and my father's case, they both have and had non-alcoholic liver damage, and you wonder, why do you have fatty liver? Well, that comes from an overabsorption of iron. If you happen to have a pathogenic H63D genetic, and I fully believe you really only need one and it will cause problems. Now I have 2. Here's the 2, and absolutely is driving me crazy. That's okay. I have to live with what I was given. Other things in here: excessive episodes of the immune system with highly variable autoimmune reactions. That's how I ended up in the ER. That probably also led to these multiple secondary diagnoses of things like mast cell activation disorder and polymyositis. Also listed is fibrosis of organ systems, and that can be fibrosis of your joints. And in my case, my ankles and my wrists, they burn if I try and use them. Also, I have on here skin symptoms. Some people start to turn yellow. In my case, I've always been way too white. My skin's too white. It's always been that way. I haven't changed any colors by having NTBI iron deposited under my skin. That's usually something that true hematomacrosis people have. One in here is disturbed motility in the digestive system. With my mother, she has severe chronic constipation. In my case, I come and go with more of like intestinal mucus and diarrhea, and I have to fight that. And that's my problem. That's my version of H63D syndrome. Eye disease is listed, oxidative microinflammatory processes, and hearing loss. So this is where your severe fatigue comes in. And in my brother's case, he's lost most of his hearing. He's probably 80 to 90% deaf. Maybe if he ever sees my video, he might correct me on that. We have bladder problems, urge incontinence in all degrees. In my mother's case, she has trouble with incontinence. It's severe with her. With mine, I have retention issues and disturbances of the adrenal glands, as well as the endocrine system. Oxidative induced inflammatory processes due to this iron will affect the adrenal cortex, and you will be diagnosed with primary adrenal insufficiency, which my doctor did write down after I went through some adrenal tests. I have adrenal insufficiency. I even have cysts on my what they call adexinal cysts. And also on here, one of the early symptoms is type 2 diabetes and high blood pressure. I have not had the diabetic problem. My mother and my father both did. As far as the hypertension, out of the blue, my systolic pressure back in 2023, I normally run around 100, went up to 141 and was uncontrollable for about 8 months, until I've figured out the handful of things that I know that are currently helping me survive. The caveat here is because of the variety of symptoms, the syndrome is usually recognized relatively late, like in my case. 7 years down the road, but in my father's case, 7 years down the road meant it was already too late. Diagnosis, there's some couple of other things here I can read before I can let you guys go. Let's see, the pathological history, the hallmark H63D syndrome. The hallmark of it is the deposition of NTBI iron in the brain and other tissues. This iron cannot be stained histologically. My mother's worked in the she's been a medical technologist and has spent her 35 years staining different cells in the lab, and she said, I can't seem to stain iron of this type. So iron deposits apparently can't be seen in tissues if you take a tissue sample. Other different information here. Under therapy, I'm going to end with this one. There currently is no treatment for H63D syndrome. NTBI iron cannot be removed by phlebotomy. So let me remind you, this is not hematomacrosis. This is different. So bleeding yourself doesn't get the NTBI iron out, but I did notice it helps lower saturation. So I have tried it twice. It's been very unpleasant, and being that I'm already anemic, it made it even worse. So the recommendation here is that phlebotomies are not recommended because the classic H63D syndrome patient already has rather low ferritin. You merely suffer a further drop in your already low ferritin level during a phlebotomy, and it makes your anemic condition worse. I was desperate. Come on. The pain is outstanding. It is unbelievable how bad it hurts to have these tiny little crystals deposited everywhere, all in your body. And phlebotomy, I was not willing to not try. And according to the very end of this, dietary control of iron intake currently is the best prevention. that's exactly what I'm doing right now. Is even though I appear to have low iron because I am considered anemic, I have to be very careful about what I eat, because anything over what my body wants to put into my blood as heme iron will be deposited as NTBI iron, and I'm not willing to go through any further pain to just eat more iron so that I might be able to increase my iron levels. It doesn't work that way with us. But anyway, I need to get to the sauna ASAP so that I can help sweat off what's oxidative damage, and I do sweat out some excess iron. That's part of heat shock therapy session. So hopefully you guys can enjoy this 20 minutes worth of me babbling about H63D. Thank you.